India will resume exports of COVID-19 vaccines soon, prioritising neighbouring countries. The world's biggest maker of vaccines stopped exports in April to focus on inoculating its own population. And since then, daily infections have plateaued at around 30,000. But there's been a warning against complacency as COVID-19 testing in India slows. Rebecca Bundan reports from Mumbai.
Fewer people across India are being tested for COVID-19. According to official figures, the number of tests being carried out right now is only about half of the country's total capacity. This comes against the backdrop of easing COVID-19 restrictions across the country since a deadly second wave hit India earlier this year, as local authorities try to boost economic activity. Most states are now no longer demanding compulsory tests for fully vaccinated domestic travellers. This comes as the country's festive season has started, and there are fears that celebrations could fuel the spread of the virus and result in a massive third wave. During the festival of Ganesh Chaturthi for the elephant-headed Hindu god Ganesh, which concluded over the weekend, many people ignored local government guidelines and gathered in Mumbai, where the event is very widely celebrated, in large groups. But the findings of a serological survey released on Friday suggest that almost 90% of people in Mumbai have COVID-19 antibodies. Of the more than 8,000 adults surveyed between August and early September, about 65% had been vaccinated. Following widespread criticism of the slow pace of India's COVID-19 vaccination programme, it has picked up significantly in recent weeks, and almost two-thirds of the adult population has received at least one dose, and more than a fifth are now fully inoculated. But India's health ministry has warned state governments that now is not the time to let their guard down, with fears that the country could be hit by a third wave of infections in the coming weeks. The ministry wants to make sure that the country is much better prepared for this possibility after hospitals ran out of beds, drugs and oxygen during the deadly second wave in April and May. It says that local authorities should ramp up testing and ensure that citizens are following COVID-19 appropriate behaviour, as well as boosting hospital infrastructure and supplies of drugs and oxygen in preparation. Rebecca Bundan, CNA, Mumbai.